Social Democrats Deputy Roisin Shortall.
Thanks, Alaska and Corley. Taoiseach, after 12 weeks of severe level 5 lockdown, the daily COVID case numbers remain stubbornly high. Leaving aside the kite flying, which has been entirely unhelpful, I have to say, in recent weeks, the question for government is, what exact steps are you going to take to address this, which will drive down the numbers and allow for some level of opening up of society and the economy? I think the vast majority of people have severely restricted their movements and their lives in what can only be described as a huge national effort to limit the spread of the virus. However, increasingly, there is a sense that government has not played its part and has not done what it promised to do. I want to raise a number of key actions required and actions that have been promised by government and seek your response, Taoiseach, and the reasons for the government's inaction across these various areas. Firstly, why have you not addressed the long-standing issues with the under-resourcing of public health doctors? Every time I've raised this for the past 15 months, there have been promises, but the matter still remains unresolved. Public health doctors are absolutely critical in a pandemic. It's indefensible that this hasn't been resolved. Related to this, of course, is the lack of retrospective tracing to establish where exactly transmission is taking place. It's such a basic thing, it beggars belief that it's not being done. On the issue of travel, arguably the biggest failure is the response in the response to COVID. People have been instructed that they must only travel for essential reasons, yet inexplicably the government has stopped asking international travellers about this since the 7th of February. That week, of course, 46% of people were travelling for non-essential reasons. Since then, we have no idea why people are travelling. On so-called home quarantining, the Gardaí have only just established pilot projects in 6 divisions for enforcement purposes. On mandatory hotel quarantining, finally introduced this week, who exactly is responsible for security? Is it the hotels, the security companies, the Gardaí, the Defence Forces? Can you tell us who's got responsibility here? On vaccinations, when will you publish the detailed plan for the mass vaccination programme? And finally, I would ask, what now is the revised vaccination target for the end of the first quarter this year? Thank you.
Thanks, Deputy. I'll do my best to answer as many questions as I can, and where I don't know the answer, I'll ask the Minister of Health to correspond with you directly. I think what I should say at the outset is we are approaching 4,700 deaths in this state of people who died with COVID. That means that we've now reached the point where as many people have died from COVID-19 this year as did all of last year. And I think that's an extraordinary statistic, an extraordinary thought when you think about it. And of course, these aren't statistics, these are people, and people with grieving families. And more people have died this year from COVID than did all of last year. And I think that demonstrates how serious the B117 variant is and how different it is to the Wuhan strain or the wild strain that we dealt with last year, and how perhaps getting down to very low figures like 10 or 50 or even 100 a day is not a prospect in the way that it was last year, because this virus has mutated. It is now much more transmissible and it is now more deadly, as we know, than the original wild strain. And despite the enormous efforts of the Irish people doing all of the right things, we've still got stuck around 500 or 600 cases a day. And it's very hard to see how we're going to get down much lower than that. But what are the kind of things that we are doing in attempting to do that? First of all, we have increased border biosecurity. It is now the strictest in all of the European Union, with mandatory hotel quarantine starting tomorrow for people coming from more than 30 countries, anyone coming without a negative test from any country, non-essential and essential travel, And we will be adding a lot more countries to that list in the coming weeks once we have the system up and running. We started walk-in PCR testing, people who have no symptoms in areas of a high incidence, 5 of them to start.
Could you answer some of the questions?
The first question you asked is what we were doing to bring down COVID, and that's the question that I'm answering. We are speeding up the vaccine rollout. We have over 700,000 vaccines given at this stage. We expect to have received over 1 million vaccines by the end of this month, but they won't all be in people's arms, probably be around 800,000 and another 1 million or so in April. We'll have the report on antigen testing soon, and that'll be used in outbreaks in other places like workplaces. And we are increasing our testing and tracing capacity, and there's never been any restriction on resources in terms of taking on contact tracers or people in public health departments. We've always said to NEFIT and to Department of Health and the HSE that this is probably the cheapest thing that we could do. It's much cheaper than the pandemic unemployment payment or the wage subsidy scheme to take on public health staff and contact tracers. There's never been a restriction on that. Just to answer your question finally on the issue of public health doctors, I very much believe that this should be a consultant-led service, and negotiations are underway between the government and the IMO about that. And should they wish to refer those discussions to the WRC or the Labour Court, both under my remit, would be happy to hear the case. But let's not be too simplistic about this either. They have a lot of public health doctors in Scotland and England and Wales, and a lot of them are consultants, and yet their death rate and their case rate is way higher than here. So let's not suggest that that was a silver bullet either.
Taoiseach, I have to say I think you were really disingenuous in the answer that you gave there. I asked you specific questions about things that the government had promised to do, about playing its part in relation to the response to COVID. Very specific questions of things that, we've been through umpteen times, and you didn't answer a single one of those questions. Look, how can you expect the public to stay with you and to stay the course when the government is not doing what it said it would do? I listed all of those things. You refer to the new variants. Yes, of course, they are the big threat, and they are what changes everything. But they have been allowed to come into this country because of the failure of the government to address the issue of travel. And like a specific question, a basic question in relation to people's reason for travel. And you stopped asking people that. Like, how can people have faith in the government if you won't address these things that you've been promising to do for the last 12 months?
Thank you.
Taoiseach, look, you have to do much better. People are just going to give up on this unless you play your part.
Deputy, I did answer your question. Increased border security, the strictest biosecurity now in the European Union, walk-in PCR testing for people with no symptoms in 5 parts of the country now, accelerating the vaccine rollout, antigen testing coming into play, and increasing our tracing capacity. And I think it's a bit disingenuous what you said about the B117 variant. That unfortunately would have come into the country inevitably. It doesn't just come through ports and airports in this state. It also comes in through Northern Ireland, and indeed did, as did the Spanish strain, which contributed to the second wave. Scotland, which brought in mandatory hotel quarantine for all arrivals over a month ago now, has found that that was not a silver bullet for them, and their case numbers are similar to ours, and they have the same issues as us in relation to a land border.